Hello, I'm Jim Rathmell. I'm an anesthesiologist and a physician specializing in pain medicine. I'm professor of anesthesia at Harvard Medical School and chair of the Department of Anesthesiology, Perioperative and Pain Medicine at Brigham and Women's Hospital in Boston. I want to tell you a bit about a paper that will appear in Mayo Clinic Proceedings that was assembled by my research group. It's titled Tapering Long-Term Opioid Therapy in Chronic Non-Cancer Pain, Evidence and Recommendations for Everyday Practice. I'd like to tell you a little bit about why we wrote the article and what I think it means for patients who are receiving long-term opioid therapy. I hope I challenge you enough that you're interested in reading it. Well, how did we come to write this paper on tapering chronic opioids? Chantal Berner-Ranella is an internal medicine specialist from Switzerland who came to Boston for 2 years. She spent 1 year doing a clinical fellowship in pain medicine and the second year doing research. And her research centered around tapering long-term opioid therapy using a cognitive behavioral therapy program that was quite structured. She worked with the psychologist in our clinic, Ron Coolidge, to assemble a structured program and then recruited patients to be randomized to either a structured tapering program or usual care. And what she found during the course of that year is that the vast majority of patients who were referred to be weaned from their opioids had no interest in being weaned. Their primary care physicians felt that they were not doing well with the opioid therapy, but the patients often felt that the opioids were the only thing that was of any benefit to treating their long-term pain, and they were very resistant to coming off of that therapy. And that spurred us to search the literature for the very best ways of identifying patients who should come off of long-term opioid therapy, and then assembling this review article that gives you the best evidence and some practical recommendations for dealing compassionately with these patients who are suffering so greatly. What's the takeaway message from our article? I think the takeaway message is that we've spent a lot of time during the last 2 decades identifying patients with long-term chronic pain and placing many of those patients on opioid therapy. The evidence for long-term efficacy is very scant. And despite that scant evidence, we really haven't ever grappled with how we should identify patients who should come off of that therapy. And once they're identified, how do we get them successfully, comfortably, and compassionately off of long-term opioids? What we've done in this paper is really underscored how little we know about the best ways to identify patients and to care for them during the weaning period. And we leave an enormous research agenda wide open for further studies to best define how to do this. How does the paper relate to everyday practice? Well, it directly relates. It outlines the problem. It really deals with some of the fundamental questions that come up as you deal with your very own patients and have these discussions about discontinuing long-term opioid therapy. And it lays out some practical guidelines for approaches to doing so. Well, what does the paper mean for patients? What it means for patients is there's a starting point for practitioners to sit down with their patients and discuss how and when to discontinue opioids. And it lays out some materials that you can use in that process, including monitoring for withdrawal symptoms and pharmacologic management to minimize withdrawal symptoms. Well, what's the next line of research in this area of tapering long-term opioids? Well, we certainly know very clearly the last few years have shown that there is an epidemic of prescription opioid use in the United States. So it's something we have to grapple with. And we believe that this paper is just the very start laying out the research agenda. It frames the problem and it highlights some of the very specific areas where we should do clinical trials to determine how best to care for our patients. And we hope that this article will be the start of a rich research program, not only in our own group, but in many other pain practices. Thank you, and I hope you will read the article and share your comments with us.